Have you ever wondered, how can I better communicate and engage with my patients? At Community Health System, we're excited to share that there is a best practice method that will give you just that. AIDET is an acronym that represents 5 communication behaviors to apply to any interaction. This framework was designed by healthcare providers to decrease patient anxiety, improve outcomes, build trust, and enhance the patient experience. The 5 AIDET's behavior are: A. Acknowledge. Knock on the patient's door or announce yourself before entering. Greet the patient and family with eye contact and positive body language. I. Introduce yourself and your role in the patient's care. D. Duration. Let the patient know how long things will take, like tests, procedures, and results. This is critical in managing their expectations for time. E. Explain, in simple terms, what's going to happen, any exams, their diagnosis, next steps, your plan, and answer questions completely. Lastly, T. Thank the patients for their time, their patience, and allowing you to care for them. The purpose of AIDET is to have better communication with our patients and their families and each other's. Their powerful communication method can improve your engagement and trust with your patients. Using AIDET with every interaction ensures consistent messaging of compassion, concern, and appreciation. What you're about to see are short video examples of how to apply AIDET by seeing interactions without AIDET compared to interactions with AIDET. Embrace AIDET and experience the difference in patient care and satisfaction. Give it a try with your next patient. I'm Dr. Mohammed Fayed. I'm an associate clinical professor, Pulmonary Critical Care Department, UCSF Fresno Community Medical Center. Hi, Mr. Smith.
You can call me Bill.
Okay, my colleague was telling me about your case. You came overnight with hematemesis. Hi, Mr. Smith.
I'm Bill.
Okay, I'm your doctor. Gonna take care of you today. So we'll see what's happening. It looks like you came with pneumonia, so we'll give you some IV antibiotics.
Oh,
All right?
okay.
So I'm looking at your case here. It looks like you have a lung mass.
Oh.
I'm gonna talk to one of the doctor and see if they can do biopsy. It might take days. Who knows? So we'll call the doctor and see. Okay.
Okay.
Mr. Rodriguez. I'm looking at your imaging here, and it looks like you have this mass invading into your soft tissue. It could be malignancy or coccidiomycosis. We'll do lab to UC Davis and see.
Can you tell me a bit about what that means? I'm not sure.
We don't know if it's malignancy or coccidiomycosis. Let me just get this phone call, okay?
Okay, but are you my main doctor, or who do I?
I know a lot of doctors, but we'll try to talk to either one and see which one can do it. Okay, I'll talk to you later. A stands for acknowledge. Before you come to the room, you knock on the patient's room. Show respect. Smile and greet the patients. Good morning, Mr.
Good morning.
Smith.
You can call me Bill.
Hi, Bill. I'm Dr. Fayed. Nice to meet you.
Glad to meet you.
Okay, I looked at your case very carefully today. I stands for introduce. Introduce yourself to the patient and to the family. Provide your name. Explain your role of their care. How are you doing?
I'm doing pretty good.
Okay, I'm Dr. Fayed, one of the lung doctor. Dr. Sandhu called me to evaluate you after coming yesterday with pneumonia. D stands for duration. You need to give them the time expectation when they're going to have the result, the testing, the imaging, everything you need to do for them to give them an accurate diagnosis. I looked at the imaging, and it looks
Okay.
like you have a lung mass. I called the lung doctor to come and see you to do the biopsy, and they told me that the biopsy can be done tomorrow.
Okay.
It takes about 3 days to come up with the result. But the good news is you can actually go home after the procedures,
Oh.
maybe a few hours of observation. Then they will contact you next Monday to, discuss with you the result.
Okay.
Okay?
Thank you.
E stands for explain. When you keep the patient informed, it shows how much you care for them. Step by step, it's really important to keep them informed. I was called by Dr. Sunju to look at your case. I evaluated the CT scan. You have a lung mass. This is a collection of inflammation or other cells in this area of the lung. Given your age, I really favor that looks like infection,
Okay.
but we always want to make sure it's not something else. We're going to do a blood test to see if you have this infection, the valley fever, fungal disease that's coming from the environment here in the Central Valley. If it's positive, we'll give you the medication right away.
Okay.
Any questions?
I mean, it's really overwhelming what you just told me. Is there anything that I need to be worried about right away?
Well, that's a good question. I mean, this infection happens all the time to people. The most important thing is to differentiate which one is which.
Okay.
And the good news is we're going to get the result today. So as soon as I know, I will come and tell you immediately.
Okay. That
Okay?
sounds good.
All right. T is to thank the patient. Let the patient know that you have enjoyed helping them. It's very nice meeting you.
Nice meeting
We'll
you
take
as
care of
well.
you. I want you to be, comfortable with us. We'll definitely get to the bottom of it to give you a diagnosis immediately.
Okay. I appreciate that.
All
Thank
right,
you.
of course. Thank you.